Research benefits my patients every day because we always have the opportunity at a place like Weill Cornell to find experts who are exploring the new causes and treatments of different medical conditions. And by bringing that expertise to the patients every day, we're able to do a better job treating them, taking care of them, and offering them cures. One of the most amazing things about working here at Weill Cornell is that we are part of an incredible team, a team that brings together clinicians, researchers, scientists, and brings that to bear on a patient's medical condition. That is the most gratifying of all. Very recently, I had a young woman in her late 30s with colon cancer, and we were able to diagnose her very, very early, in part because of the multidisciplinary effort we have here at the Monahan Center. And we were also able to offer her cutting-edge genetic testing that determined that her tumor wasn't part of a familial syndrome, and that made a huge difference to her and to her entire family. This particular patient was concerned that her children would be at risk for colon cancer and that she might be at risk for tumors in other locations. But looking at her genetics and with the genetic counseling team that we have as part of the colon cancer initiative here, we were able to profile her risk, reassure her, and reassure her entire family that they weren't at risk as well. And also this week I had a young patient who had a very unusual muscle symptom, and one that I'd never heard of. But by calling around to the neurologists and the neuroscientists here, I was able to find a set of tests that may delineate a problem that she's had for many, many years. So that's very gratifying to be able to do that for a patient. Just recently I saw a patient who'd had recurrent miscarriages, and we have an extraordinary team of reproductive doctors here at Weill Cornell, and I was able to refer her to our team, who did a minor surgery on her, and within 3 months she was pregnant with twins, and my exam rooms are all filled top to bottom with birth announcements from patients who've been helped by our team here at Weill Cornell. The groundbreaking research that we have really leads to earlier detection of disease and better cure rates. And in fact, many of the treatments that we now apply are less rather than more, and that we're able to recognize based on clinical and basic research studies that less treatment may be just as good for some patients. So we can offer them cure rates that are the same with much less toxicity. Some of the newer research has enabled us to use certain drugs more specifically and effectively. And for instance, in many breast cancer patients, we were routinely using tamoxifen. There are alternative treatments, and it allows us to specifically cater the treatment to the disease, the tumor, biologically, not just by its generic diagnosis, but really by how the tumor behaves and what characterizes that particular tumor in that particular patient. I think one of the most exciting areas right now in medicine is understanding how blood clotting is initiated. And we now know that blood clotting can cause heart attacks and strokes as well as recurrent miscarriages. And so understanding the basic biology of blood clotting and looking at mechanisms to interfere with that will ultimately enable us to prevent strokes, heart attacks, and miscarriages. And that really represents a big part of our population. If you think about what most people in this country die of, it's of heart attack or stroke. So being able to understand the mechanisms of blood clotting and preventing blood clotting will be a major advancement for our patients. And we at Weill Cornell are at the forefront of vascular biology. This is a great place. This is truly a great place to work. This is truly a team of friends who works for the benefits of the patient, with the researchers, the clinical researchers and the clinicians all side by side. And the new research building is going to promote and expand that effort for us. It's really the difference here. It's a sense of civility, a sense of teamwork. I believe it comes from the leadership, it comes from the top down. But there's an extraordinary camaraderie here, and it works to the benefit of our patients.